Good morning, everyone. Thank you all for joining our virtual news conference. I'm Dr. Bill Schaffner, Medical Director of the National Foundation for Infectious Diseases, the NFID. The mission of NFID is to educate the public and healthcare professionals about the prevention and treatment of infectious diseases across the lifespan. I think we can all agree that the past year and a half have certainly underscored the importance of this work. On behalf of NFID, I'm pleased to welcome you this morning to talk about influenza, also known as flu, as well as pneumococcal disease. Before we begin, I want to remind those of you on social media to please join the conversation by using the hashtag #FightFlu and #PreventPneumo. We are pleased to be joined by Dr. Rochelle Walensky, Director of the Centers for Disease Control and Prevention, for the keynote presentation. I'll then moderate an interactive discussion with our panelists, followed by questions from members of the media. Media may submit questions at any time via the box below the webcast video on your screen. Please be sure to include your name and the media outlet you represent. All questions, we're going to hold them until the end of the discussion. Now, joining Dr. Walensky for the panel discussion are Dr. Laura Riley, obstetrician and gynecologist in chief at New York Presbyterian Weill Cornell Medical Center and chair of the Department of Obstetrics and Gynecology at Weill Cornell Medicine. Dr. Cedric Jamie Rutland, CEO of West Coast Lung and COVID-19 Medical Director at Private Health Management, and NFID President-elect Patsy Stinchfield, a pediatric nurse practitioner who serves as an affiliate faculty member at the University of Minnesota School of Nursing. Before I turn it over to Dr. Walensky, I'd like to offer a few remarks. We were all relieved that there was historically low flu activity during the 2020-2021 flu season. Mask wearing and social distancing, along with school closures and reduced travel, likely contributed. But as I always say, flu is unpredictable. And for the upcoming season, we anticipate seeing flu activity once again with relaxed COVID-19 mitigation measures. The medical and public health community are preparing for a potentially vigorous respiratory virus season in the United States. The best way you can prepare is to get an annual flu vaccine. CDC recommends that everyone aged 6 months and older get vaccinated each year. Now, importantly, even in cases when flu vaccination does not prevent infection completely, it can reduce the duration and severity of illness and prevent serious complications, including hospitalization and death. Flu vaccination is critical for everyone, of course, but it's especially important for populations at higher risk for complications from flu. And these include pregnant women, children under age 5, adults age 65 and older, and those with certain chronic conditions, such as diabetes, lung disease, or heart disease. Flu season is also a good time to make sure that you're up to date with pneumococcal vaccination, because flu increases the likelihood of getting pneumococcal disease. This year, NFID again commissioned a nationally representative survey of US adults to understand knowledge and attitudes about flu and flu vaccination and pneumococcal disease. Frankly, we were alarmed to learn that when it comes to flu vaccines, 44% of US adults are unsure or do not plan to get vaccinated against flu during this season. And nearly 1 in 4 who are at higher risk for the flu-related complications said they were not planning to get vaccinated this season. Now, on a more positive note, the pandemic does appear to be driving changes in some prevention behaviors. For example, 54% of US adults plan to wear a mask during flu season. They've learned some lessons. And 45% say the pandemic will make them more likely to stay at home from work or school if they are sick. That's good news, but it does not change the fact that the single most important thing you can do to help protect yourself and others is to get vaccinated. Among those who do not plan to get vaccinated against flu, the top reasons cited were that they don't think flu vaccines work very well, and they say they never get the flu. Folks, flu vaccines work. While vaccine effectiveness, of course, can vary from season to season, even if you do get the flu, the vaccine can prevent you from going to the emergency room, being hospitalized, or dying. What's wrong with that? With regard to pneumococcal disease, which can be a serious complication of flu, our survey showed that 51% of adults most at risk, including those aged 65 years and older, and those with underlying health conditions, are not familiar with the disease. And only a third, 32%, of those at risk have been advised to receive a pneumococcal vaccine. On the other hand, the good news is that among those who have been advised to get vaccinated, the majority, 84%, the substantial majority, have received a pneumococcal vaccine. So this underscores a very important point. As healthcare professionals, our recommendations matter. We need to insist that our patients are up to date on pneumococcal and flu vaccines. We have some work to do. We all need to make it our mission to get a flu vaccine this year. That all said, I'll now be happy to turn the program over to Dr. Walensky to share data about last flu season and how, going forward, we can protect the nation from flu and pneumococcal disease. Dr. Walensky.
Thank you to the National Foundation for Infectious Diseases, Dr. Schaffner, and all the panelists who joined me here today to help motivate Americans to get a flu vaccine this season. I've never missed a flu vaccine since I was a medical student in 1995. I've had a few bouts of the flu, having been exposed to some patients while on clinical service, and it is not something I want to have again. With the protection of the flu vaccine, I have been fortunate to have never been sick enough to be hospitalized, but I certainly remember those bouts well enough to not want to repeat them. This is why I'm pleased to join the panelists today to share new information about flu vaccination coverage last season and to kick off this season's flu vaccine campaign with NFID. As we all know, flu seasons are unpredictable. Last season was notable for the near absence of flu. This low flu activity was likely due to the widespread implementation of COVID-19 prevention measures like masks, physical distancing, and staying home. While flu activity remains low at this point, we have seen the return of other seasonal respiratory viruses like RSV. And as COVID vaccination coverage continues to increase and prevention measures are relaxed in some areas, we are preparing for the return of the flu this season. The low level of flu activity last season could set us up for a severe season this year. Why? Well, because of so little disease last year, population immunity is likely lower, putting us all at increased risk for disease this year, especially among those most vulnerable, including our children. This is why it is doubly important this year that we build up community immunity with flu vaccination as we head into the fall and winter. CDC recommends everyone 6 months and older get a flu vaccine every season. And that means that now is the time to get vaccinated. Last season, CDC estimated about 52% of the overall US population 6 months and older got a flu vaccine, which was similar to coverage during the previous 2019-2020 season. These data were released by CDC today, along with 2 other online reports on influenza vaccination coverage in the US last season. All 3 reports are now available on CDC's Flu VaxView webpage. We're encouraged to see that overall vaccination coverage held steady, even in the midst of the country's worst public health crisis in more than a century. But there are some concerning findings. While we see increases in vaccination coverage among adults, flu vaccination coverage among children decreased by about 5 percentage points, from 64% to nearly 59%. This decrease in coverage is likely related to the ongoing pandemic disrupting access to routine medical care. And this is a concerning drop because flu can be especially dangerous for children. During the 2019-2020 flu season, 199 flu deaths among children were reported to CDC, a record number for a single flu season. Consistent with findings in other seasons, about 80% of those children were not vaccinated. And we know flu vaccines can be life-saving. I hope we can reverse the drop in vaccination coverage we saw among children and protect our children this season with a flu vaccine. I also want to discuss a worsening disparity among both children and adults in certain racial and ethnic minority populations, groups of people who are disproportionately impacted by serious flu illness, which can result in hospitalization, intensive care unit admission, and death. For both adults and children, significant disparities in flu vaccination coverage by race and ethnicity have worsened in the past year. The estimated vaccine coverage for all people 6 months and older increased for white people to about 56%, but decreased for Black people to nearly 43%, and remained similar to the previous season for Hispanic people at about 45%. This increase in coverage among white Americans and the decrease among Black Americans resulted in a disparity gap in vaccination coverage between white people and Black people that grew over 4 percentage points to a difference of nearly 14 percentage points. The difference between white and Hispanic people grew to a difference of over 11 percentage points. These differences are simply unacceptable and contribute to overall poorer outcomes in our minority communities. Given this lower vaccination coverage and the higher risk of serious flu outcomes, it is particularly important that we reach people in these racial and ethnic minority populations to encourage vaccination and ensure flu vaccine is easily accessible. This is also the case for other groups of people at high risk for flu-related complications, where vaccination coverage also remains sadly inadequate. Only about half of adults between the ages of 18 and 64 with at least one chronic health condition received a flu vaccine last season. We know that during flu seasons, 9 out of every 10 people hospitalized with flu had at least one underlying health condition. Diabetes, asthma, chronic lung disease, and chronic heart disease are among the most common long-term medical conditions that place people at higher risk for flu-related complications. Even if you have only one well-managed underlying health condition, you may be at higher risk for flu-related complications, and a flu vaccine is the first and most important step you can take to protect yourself against flu. For pregnant people, vaccination coverage remains similar to the prior season with about 55% coverage. This means nearly half of pregnant people and their babies were still unprotected from flu. Pregnant people are also at higher risk of serious flu-related complications, and a flu vaccine can provide protection to both the pregnant person and to their baby after it's born and is still too young to get vaccinated him or herself. We cannot and should not leave those who are most vulnerable unprotected. I also want to acknowledge the uncertainty we have been living with through this past year and what to expect heading into this fall and winter. For both flu and COVID-19, vaccination is critically important to protect ourselves, our families, and our communities. And while COVID-19 vaccines have been a central focus for both public health professionals and the public for several months now, we must not forget the importance of other vaccinations like flu vaccines and pneumococcal vaccines. If you haven't gotten your currently recommended doses of your COVID-19 vaccine, get a COVID-19 vaccine as soon as you can, and ideally get a flu vaccine by the end of October. Flu and COVID-19 vaccines can be given at the same visit. I also want to encourage our parents whose children may have fallen behind on their routine vaccinations to talk to your pediatrician about a flu vaccine and about catching up on other recommended childhood immunizations. And for adults 65 and older, flu season is a good time, as Dr. Schaffner said, to make sure you are also up to date on your pneumococcal vaccination. Your doctor can help advise you on which vaccines you need and when. I got my flu vaccine this week, and I encourage everyone to do the same. Now is the time. While we don't fully know what to expect for this upcoming flu season, we do know the actions that we take can protect ourselves and our communities against the flu. There are many reasons to get your annual flu vaccine. This year, our flu vaccine campaign promotes the different reasons people might have to get vaccinated, whether it's to protect your health, heart, or lungs, a family member who might be at higher risk, or your community health system. We all have reasons to get it. For me, I get my flu vaccine each year to protect myself. I've had flu and I don't want it again. I've always gotten the vaccine to protect the patients I've cared for in the hospital, and I want to protect my family. I certainly wouldn't want to bring disease into our home. Influenza seasons are unpredictable, and flu can cause serious illnesses among healthy children and adults. And I get it. We are all tired about talking about vaccines. I get it that we are all doing our best to protect our health and the health of our families. I also want to make sure we all get it, that we all get how serious flu illness can be and get how important a flu vaccine is to protect us this season. I hope you will get it this season and join me in getting vaccinated against the flu. Thank you very much.
That's lovely, Dr. Walensky. Thank you for that comprehensive statement and encouragement of all of us to get vaccine. As I say, don't encourage, insist, and you've done a wonderful job in doing that. Now I have a few questions for our panelists. Patsy, we'll start with you. Parents have had a pretty difficult time during the pandemic. Dr. Walensky alluded to that. Many of their children are now back in school. What can parents do this year to help protect their children against influenza?
Well, thank you, Dr. Schaffner. Yes, schools have had a difficult last couple of years, and families. The worst thing and the last thing we need is a flu outbreak on top of all of this. So what we need to do is really take this message forward. Everyone 6 months of age and over, first thing is get their flu vaccine. Now is the time, making sure that you don't go to school when you're sick. Don't send your child to school when you're sick. Don't go to work when you're sick. Wear that mask, wash your hands. And really, I think all of us need to do better about taking that responsibility about who's my community. For kids, it's their school. And how do I protect my community? I do that by protecting myself, getting vaccinated, and vaccinating everyone around your children. As you heard, it's young children 5 and under that really can get severely ill, but some of the sickest kids I have seen in my 43 years in children's hospitals are high school adolescent sports activists, so hockey players and volleyball players. So you may think, well, my kid is healthy and they're strong and they won't get the flu. All of us, if you're 6 months and over, we are talking to you. So it is time. It is pumpkins and costumes and flu vaccine. It's go time, parents and grandparents. Thanks.
That's great, Patsy. I'm going to add a friendly amendment, if I may, and feel free to comment. If your child is under 8 years of age and has not received flu vaccine before, your child needs 2 doses separated by a month. All the more reason to start right now.
That's exactly right, Bill. That's exactly right. And as we know, most of our data that it's really after we gather around the Thanksgiving holiday that influenza really starts to take off. So it's not too late if you do that dose 1 now and dose 2 in a month. You'll be ready before there's any kind of safe gathering.
Great. Now I think I'd like to pass it on to Laura. You're next up. There's been a lot of news, Laura, about pregnant women being especially concerned when it comes to getting vaccinated. Please, can you address some of these concerns and explain why a flu vaccine is so important for pregnant women. Dr. Walensky mentioned some of those, but let's put an exclamation mark next to some of those issues.
Absolutely. I think that we do need to put an exclamation point next to pregnant women who are at increased risk for severe disease due to flu, hospitalization, and death, unfortunately. And I think, every year we see pregnant women who are quote unquote healthy, other than being pregnant, and they get the flu and then they have some really severe outcomes. I think what's concerning for pregnant women is that, we as obstetricians and OB providers spend a lot of time saying, don't do this, don't eat that, don't do. And I think that the natural reaction for a pregnant woman is, you're going to stick something in my arm and, give me a medicine. So I think that, part of the consternation is what we've created. But the flu vaccine has been used in pregnant women for years and years and years, and we have a ton of safety data. I think that that's what gets pregnant women. Is it safe for me? Is it going to be safe for my baby? We have more than enough data to suggest that the flu vaccine does not increase the risk for miscarriage, doesn't cause preterm birth, doesn't cause birth defects, all the things that run through people's minds when they're having a baby. The other thing I think that's important just to underscore for pregnant people is that not only will the flu vaccine protect you from the severe, outcomes that we've talked about, but also it protects your baby for the first 6 months of life before that baby can be vaccinated. And that's super important. We know that the risk of death in a newborn is actually quite high if they get the flu. So if mom gets flu vaccine and transfers those antibodies through the placenta, through the cord to the baby's then protected. So, you're doing a lot of work there with that one shot. And we just need to underscore that for pregnant women. The other thing is that I'm just going to throw this out there. I have to remind, people who are taking care of pregnant people and their babies, some doctors forget to give the shot. So what we really need to do is, every single time a patient shows up for prenatal care is to ask them about their flu vaccine. Have you gotten it? And if they haven't gotten it, give it to them right then. Sending them across the street or sending them, to wherever to get it is a sure bet that it won't happen.
So Laura, this is terrific. I'm going to emphasize several things just for the purposes of emphasis. One, flu vaccine in pregnancy is safe. Number two, women who acquire influenza have rates of complications that are comparable to that occurs in older people. So flu vaccine protects the mom. And then the real selling point is mom's protection can go through that placenta into the baby and protect that newborn during the first 6 months of life before we can directly vaccinate the baby. I actually think when moms hear about the protection going in and protecting their new baby, they start rolling up their sleeves. What do you say?
Exactly. I agree with you 100%. One other thing just to add, because this question comes up frequently, is when during pregnancy is the best time to get the flu shot. It is now. It is during flu season. Do not wait, because while you're waiting for I don't know what, you are unprotected. So go ahead and get it today.
Thank you. Jamie, here's one for you. People tend to downplay the flu. We know that, it comes every year. We don't have to worry about it. Given your firsthand experience working in the intensive care unit, can you share some of the effects flu has on the body in terms of the inflammation it evokes and what this means, particularly for older people and those with chronic health conditions?
Dr. Schaffner, I so appreciate you bringing up this term inflammation. When I'm rounding in the intensive care unit and I'm looking at individuals' images, I'm looking at x-rays, I'm looking at CT scans, what exactly am I looking for? I'm looking for the severity of inflammation in their lungs. That is the recruitment of certain cells to come and fight influenza. And that is the problem that happens in these patients is because of the white blood cells that are congesting these air balloons, which your lung is made out of, that's why people cough, become short of breath, and end up seeing me. And so what we're trying to accomplish with the flu vaccination is we're trying to get those white blood cells used to seeing influenza and not responding in a way that is detrimental to individuals who have these chronic health conditions like COPD and diabetes. We want these individuals to have the appropriate, almost benign exposure when you get a vaccination, so the immune system is used to seeing this and doesn't over-respond. Because we all know that that over-response is inflammation, and inflammation in end organs is the real problem, and that's what presents people to me in the intensive care unit.
Yeah, very, very important. And so, Jamie, my understanding is that this inflammation can actually proceed and continue or be active after you recover from acute influenza and can increase the risk of your having a heart attack, for example, in the several weeks after you recover from influenza. So if you can prevent influenza on the front end, we're actually not only preventing influenza, we're helping to prevent some heart attacks. Would you like to comment?
Yeah, that's an interesting concept, and I think it's very important. Again, one of the terms I had mentioned earlier, I think, was COPD, which can be inflammation of those airways. When people develop inflammation of those airways, secondary to an organism like influenza, that inflammation ramps up across the body, and those individuals, just like Dr. Schaffner said, do have a higher risk of having myocardial infarction in the subsequent weeks, and that is an issue. And so when you get vaccinated and you prevent that inflammation, you're also controlling other conditions and exacerbations of other conditions, like a COPD exacerbation, like an asthma exacerbation, and also like preventing stroke and reducing myocardial infarctions or heart attacks.
Right. I mean, it's a bonus, one thing after another, getting flu vaccine. Apropos, Dr. Walensky, what can we do better? What can we continue to do to ensure that folks are getting the message about how important it is to be vaccinated against both flu and COVID to minimize the impact on, for example, not only themselves, but the entire healthcare system?
Yeah, absolutely. It's our job. It's my job. It's all of our jobs to provide the public and our patients with the information that they need to feel confident in making the decision to get a vaccine. They have a lot of questions. We want to hear those questions. We want to answer those questions. And I say it's not my job to convince you should get it. It's my job to give you the information you need so you want it. We know that both flu and COVID-19 vaccines are safe and effective in preventing serious illness. And we also know that people have questions and concerns, and that's okay. So we're here to bring you the latest information we know about how vaccines help people and to help them make the decision to get vaccinated. I want to hear the questions people have. I want to bring them the scientific and accurate information to help feel reassured. We at CDC have what we call vaccine confidence consults. When people in our community-based organizations are getting questions they don't know how to answer, we have the answers for them and how we can get information out there to the public. If you still have questions, please talk to your healthcare providers. Please talk to your pharmacists. Get information about your risks and benefits of getting those vaccines. We have lots of information on our CDC website, but I also want to reiterate that our professional societies have a lot of information out there, whether it's the American College of Obstetrics and Gynecology, the American Thoracic Society, Infectious Disease Society of America, American Medical Association. Many of our professional societies have information. So go to your favorite trusted source and get the information you need. And once you have that information, I think you'll recognize the power of these vaccines. And don't just ask about the vaccines themselves, but ask about the risk of the disease too.
Excellent, thank you. And along those lines, and I'll open this to everyone, but perhaps start with Patsy, because I know you've been interested in this. Information is, as Dr. Walensky says, fundamental. That goes to your brain. But people also have to feel comfortable and reassured that getting a vaccine is a good thing. You've been very involved in that a little bit. You want to comment on that?
Yeah, I think we're all concerned about that misinformation access that people have through social media. And so I think, as the survey showed, people do trust their healthcare providers, their clinicians, and we as clinicians need to be ready for those conversations. And the first thing we need to do is listen. What are their concerns? No shame, no blame. Listen and find out what their story is. Everyone's got their own reason. And at the bottom of it, some of it has to do with trust, which is why I think healthcare providers are the best person to teach, because there is that relationship often. So talking to a trusted, knowledgeable person. And then secondly, the other base is often fear. And so really trying to tease out, well, what is it that you're afraid of? And sometimes people are more afraid of the vaccine than the disease. And that's where we can say as clinicians, oh, let me tell you, I haven't seen a single child in the hospital, in the ICU after a vaccine with a vaccine reaction. I haven't, but I've seen lots of children with very, very serious influenza. And then you can just talk through that. So making sure we understand what their concerns are and where they're coming from.
So Jamie, I see you nodding. Would you like to get into this quickly?
Yeah, one of our missions at Association for Healthcare for Social Media was this problem of misinformation on the internet. And I spent a lot of time discussing this with my colleagues, and it's like, oh, well, we have to combat that. No, you just have to put out information that is correct, and you have to start with education. One of the things that I try to do is, listen, I go to the barbershop every single week like clockwork. What I try to do is I bring a dry erase pen, and I will get on the mirror and I will teach these individuals about vaccination, how they work, why they work. I teach them immunology, and I teach them in a way that allows them to understand what's going on in the body and what the white blood cells are actually doing, because there are a lot of questions. And I think it just takes time to educate and let them come to their own conclusion. I don't need to tell them their conclusion. They're going to get to where we are as long as we provide the appropriate foundation for them to get there. And I think that's what it takes. And I think that's one of my missions in life.
Good for you. And you're doing it in a setting where you can have conversation with people that when they're comfortable and they're ready to receive information. Now, I'm going to say we've been chattering along, but we're here on behalf of our colleagues, the journalists. So I'd like to turn this over now to NFID Executive Director and CEO Marla Dalton, who's going to share some questions from our colleagues in the media.
Thank you, Bill, and thank you to all of the panelists for those very inspiring remarks. I'm pleased to say we have a lot of questions. I hope we have enough time, but we'll dig right in. And our first question comes from Erica Carbajal from Becker's Hospital Review. And the question is, how many people have received their flu shot in the U.S. so far? And are there any indications that we will, in fact, have a more severe flu season?
Well, Rochelle, perhaps you could address that.
Yeah, I can give it a go. I may reach out to my team as well. I can't tell you the absolute number, but what I can tell you is we're on track exactly where we were about this time last season, when we were able to get to about 52% of the population vaccinated. So our trends and how many people are really on similar track as to where they were before. I'm wondering if Dr. Grosskopf has anything to add in terms of the absolute numbers.
Hi, this is Lisa Grosskopf. I think Dr. Stokely may have some more information, but what we do know, at least for the previous season, coverage overall was similar to the coverage estimates for the prior season. I don't know that we have any absolute numbers for this season yet. Dr. Stokely?
Hi, this is Dr. Stokely. So as mentioned, we don't have specific numbers at this moment, but we will be posting updates every month on where we stand with flu vaccination coverage. We have a flu vaccination dashboard that will be available on the cdc.gov website. And so I recommend people to visit that site frequently to see progress with vaccination coverage.
Thank you all. Marla?
Thanks. The next question comes from Jan Hoffman with the New York Times. What are your recommendations about the spacing of flu, pneumococcal, and COVID booster shots, especially in older adults? And how soon after someone gets a flu shot are they protected?
So, Patsy?
Certainly, we can give flu vaccine and COVID vaccine on the same visit. You don't need to separate them. Usually we will administer them in separate arms, and your immune system recognizes it right away and will start to build those antibodies. At productive levels, we'd say it's about 2 weeks thereafter.
Excellent. Next question, please.
Next question comes from Julia Reese from Healthline. Do we have any takeaways from last season about contracting flu and COVID at the same time? What's the risk? Does it happen? How common is it? And what should people understand about co-infection?
Well, I know there've been a few such case reports. Jamie, do you have any insights into that, or perhaps some thoughts about whether these two viruses together will make you more severely ill?
You know, that's actually interesting. I have seen a couple of cases of people who have had both infections simultaneously. And I will tell you, at least in my experience, and this is not reflective of everyone, in my experience, the cases that I have seen, those individuals were taken care of at home, but when they presented to the ER, they were positive for both influenza A and SARS-CoV-2. I do find it interesting because the inflammatory response, the immune system is going to be activated. But I will say in one of those individuals, they were vaccinated against SARS-CoV-2, but they were not vaccinated against influenza yet this year. So I can't give you specific details in regards to how these individuals are going to behave from a pathophysiologic standpoint. But I can tell you that at least in this individual, because they were vaccinated against SARS-CoV-2, they didn't seem to have that extreme activation of the inflammatory response, which quite frankly, we're all afraid of.
Yeah, excellent. Another reason to get vaccinated against both. And I think if there's more clinical information forthcoming, we may see a bit more this year, because obviously we're going to have more flu this year. So there'll be perhaps more opportunities for both of these viruses to get together to try to make people sick. We'll just have to see how frequently that happens. Marla?
Our next question comes from Bara Vaida with the Association of Healthcare Journalists, and it's directed to Dr. Walensky. Would you elaborate on your point that low flu activity last year could set us up for a severe season this year? Why would that be?
So yeah, it's a great question and one we are watching really carefully. So when there's active flu one year to another, then we have more people, not just those who are vaccinated, but we have people who are actually sick, who have built up some protective immunity from the season prior. That immunity actually helps us year over year, and especially for those who might not have gotten vaccinated. If they had gotten the flu last year, they may have some residual immunity against getting the flu again this year. So we have not a lot of protective immunity from last season. And because of that, we are worried as a community that we will have less immunity overall. And that's really why we're anticipating, especially as our protective prevention strategies start to decrease in some areas, that we will see more flu. The other signal to this is that we've already seen some other respiratory viruses start to emerge that have been, that we had not yet seen. So we had a large bout of RSV, respiratory syncytial virus, in the last couple of months. This is atypical for this season with RSV. We usually see it and several months ahead as the fall and winter come about. So we are worried that having not seen some of these respiratory viruses in last year, because we were sort of all taking those prevention mitigation strategies, we may see more of them in the year ahead.
Well, certainly
another reason to get vaccinated.
Wonderful. We're certainly, we here at Vanderbilt are part of the CDC's surveillance system for these various respiratory infections. And just as Dr. Walensky said, we've seen an increase unseasonal, right, with respiratory syncytial virus, RSV, and that's continuing. So is that a harbinger of a worse influenza season? We don't know, but we certainly don't want a twindemic, both COVID and influenza. Let's get vaccinated against both. Marla?
Sure, that's a perfect segue. We also don't want to trifecta with other respiratory viruses. So shifting gears to pneumococcal disease a little bit, we have a question from Lori Solomon with Contagion. I understand that PCV is recommended for very young children and those over 65. For those under 65, what are the underlying conditions that would indicate PCV is appropriate?
Let's see, Patsy again?
Well, certainly the Well Child schedule has pneumococcal vaccine throughout in your early months and throughout all of your age group. You really do need to not only have your clinician ask you if you've been vaccinated, but you as a individual and as a parent need to ask, is it time for vaccines? And so following the immunization schedule, the PCV schedule does go through that primary series and then catch up in the middle age groups as well as into adulthood as well. So always checking that schedule and asking, am I due for vaccines?
Great. And Marla, I'm ready for the next question. And if there are any in the queue related to pregnancy, we need to bring those up so Dr. Riley can get in this.
You've read my mind. The next one is for Dr. Riley. How do we know that flu vaccines are safe for pregnant women?
Yeah, it's a great question. It's the question that gets everyone stuck. Just years and years of using flu in pregnancy, we have a lot of data. We are just not concerned. It's such a safe vaccine. Again, I think that, where people get worried is, does it cause a miscarriage? Is it going to cause a problem for my baby? And the answer is no. And we have lots of data to suggest that. Years, 30, 40 years, I have no idea how long. And I think people need to be reassured by that. And then the other side of it too is remember what happens if you get flu. The best prevention is going to be the flu shot. So, and we do not want pregnant women to get the flu. The other thing I was going to jump in there on RSV, whenever you're an obstetrician and you hear RSV, you start to cringe. RSV is particularly bad for newborns. Moms need to do everything they can to protect their kids from any and every virus for which there is a vaccine. And so go ahead and get your flu shot so you're not adding that to your baby's plate.
And maybe if I can just add to that we at CDC, I'm proud to say, I inherited this when I came, have an extraordinary vaccine safety data system. We've been following the safety of these vaccines for years. We have a vaccine adverse event reporting system. We have vaccine safety data link where we're collaborating across the country with universities to follow these vaccine safety in extraordinary fashion, not just for flu vaccine, but for COVID-19 vaccines in pregnant and non-pregnant people alike. So we do have extraordinary safety data that has allowed us for all sorts of vaccines to find very small needles in haystacks when they occur. We've seen extraordinary safety with the flu vaccines in pregnancy and the COVID vaccines in pregnancy.
Bravo. I would just add to that further to make the point, the American College of Obstetricians and Gynecologists, the nurse midwives, every group, every professional group that is devoted to a safe, healthy pregnancy for the mom and the delivery of the healthiest newborns endorse giving influenza vaccine during pregnancy. Marla?
The next question comes from Liz Seeger with the Association of Healthcare Journalists. For older adults in particular, is it appropriate to go to the ER if experiencing flu symptoms? And what is the risk of pneumonia developing in people over 65 with a bad case of flu?
Jamie, please.
Yeah, that's a very good question. What I think is the most appropriate for really any adult is to have a primary care physician that you have a good relationship with and you can communicate with when you have these symptoms so that they can best direct you to where you need to go. That level of communication is extremely important. With that being said, if you are positive for influenza, there is a risk of developing streptococcal pneumonia or staphylococcal pneumonia. These are other types of organisms that can contribute to the inflammation that's taking place in your lung. So yes, in individuals, my own patients, and about 10% of my practice is primary care, in my own patients, I do want to know when they're influenza positive because these are patients I need to continue to communicate with on a daily basis to see if they're demonstrating symptoms that warrant an ER visit or a hospital admission. But yes, you're more likely to get infected by strep or staph if you have influenza, pneumonia, or influenza preceding that initial infection. So that is important information to understand and know.
Great. You know, I think.
May I add to that just for a minute and say I completely agree. The other thing I would do is call said healthcare provider that you have and tell them about your symptoms, because they very well may want to test you for influenza and for COVID. The symptoms are similar, so you may merit a test for both. But importantly, we want you to get treated, and the treatment works best if we give it early. So don't wait days and days and days to call, but call when you have these symptoms, when you have high fevers, have this cough and feeling flu-like, and see if you need a test and if you merit treatment.
See, Dr. Walensky is still a clinician. I love it. and I'll bet you'll endorse my next comment. You know, particularly for people who have underlying illnesses, older people who are frail, have that conversation with your practitioner, and practitioners have that conversation with your patients so that they know what to do if during this winter season they develop symptoms, right? So that they know that they can call you or your colleagues and get on the right track, so we can do the testing, do the treating just as quickly as possible.
For pregnant people, it's really, I'm sorry, for pregnant people, it's really important to call early because, you know, your oxygen level can't go too low before it becomes an issue for your baby. So we want to know if you're having those symptoms, even if they seem mild, because, you know, we want to test you, or sometimes we don't even test. Most pregnant women, we don't test. If we think it's flu, we're going to give you medicine. That's how serious we take it. So call early.
Thank you.
Great,
Paula?
Bill. We have another question from Fennet Nurapil from the Washington Post. And I think this is based on some of the NFID survey data. So what does the latest data tell you about how Americans' approach to flu and flu vaccines has or has not changed since the pandemic began? Do you see any evidence that they are more or less wary of shots or relying more on masks in lieu of vaccines?
I think that's a complicated question, and I'm not so sure I know the entire answer. And I think that there probably are two groups of people out there. There are the very careful who are following this very, very thoughtfully. And the data from the NFID survey indicate that there are many people now who, when they encounter influenza in their communities, will put back on their masks. They know how to use those. They'll do a little bit more social distancing. They'll rent a movie rather than going to a movie. There are other folks still who, as we know, are still pretty cavalier about influenza and probably won't take those precautions. But I think we'll hear increasingly public health, in addition to reinforcing the importance of vaccination, mentioning the utility of masking, social distancing, being careful, particularly for those people who are at high risk of the complications of both influenza as well as COVID.
You know, one
Rochelle?
thing.
Go ahead,
Rochelle, I saw you nodding, and then Jamie.
I was just going to say that I think all of our jobs, as we have vaccines on the front line of nearly every newspaper frequently these days, is to remember that the common foe is not one another, and it's not the vaccine, it's the disease. And so that we really do need to unite against influenza, against pneumococcus, and against COVID, so that we are all in this together. And the best way to do that is to get vaccinated. Jamie.
Yeah, one thing's for certain, you know, when you walk around the hospital these days, we are all wearing masks religiously. And it's something that I think is important. I think it's something that's going to lead to protecting at least some of our patients and individuals from influenza and other infections, because we're wearing masks. So in the question, what I heard was, are more people wearing masks? And I would say, yes. When I walk around the hospital, which is probably the most important place to wear a mask, that's what you see. 100% of individuals are masked. And I think that that's important to understand, important to see, and important for all of us to do to help prevent infection between patients.
Yeah.
And Bill, if I may add, I'm sort of a glass half full person. So when I look at that survey, the majority of people are vaccinated, plan to be vaccinated against influenza. That's 61%. And so let's do that sort of social norm. I will stop at red lights. I will, not smoke inside a restaurant. I will get my flu vaccine and COVID vaccine. And we just need to get that other percentage up there, because more of us vaccinated protects all of us better. The vaccines work better when we're all vaccinated. And in clinics, don't be afraid to go to a clinic. We have very, very good infection prevention interventions, many of which you don't see: air handling and cleaning and the things that we do to make sure that disease is not spread. So don't be afraid to go in. And when you do, ask about all your vaccines.
Wonderful. Marla?
Perfect. Next question comes from Alexander Tin with CBS, and it's directed to Dr. Walensky. Can you tell us how the surveillance and response for flu is different this year at CDC compared to previous seasons?
Absolutely. We have a lot of work. We're doing both surveillance for COVID as well as surveillance for flu. We are not really changing our methods at all for how we generally report flu, and we will be reporting it as we always have, looking for influenza-like illness, reported hospitalizations among adults and children, and reported deaths among children and as well as among adults. What is different, just to note, is that last year, there was so little flu that it was actually hard for us to estimate. And so we should be hopeful that we are there, but I don't think all of our anticipation is that we will get there again this season. I think we have to be prepared for a potentially bad flu season. And so we are monitoring now, and our job now is to monitor both influenza as well as COVID-19.
Marla?
Great. And the next question, which I think we've all heard many times, is how do we really know that flu vaccines won't give you the flu?
Patsy?
Well, the way that the influenza vaccine is designed is such that your immune system recognizes it. And you think of this as, practice. So you can, and when your kids are saying, I don't want to go get my flu shot, you say, well, you practice for your sport, you practice for your choir, you practice for band. We're going to practice with your immune system. You give it a little bit of a vision ahead of time. It doesn't give you, it's inactivated. It's not a whole virus. It's not a live virus. It's not possible to get influenza from the flu vaccine. What it does, though, is gets you ready and lets you practice. So when the real deal virus comes your way, your immune system is ready to go.
Right. You cannot get flu from the flu vaccine. That's an old myth. Please, you can't do that. Virtually all the vaccines are made up of only parts of the virus, right? And so there's no way that they can create the virus in your body to make you sick from influenza. There is one influenza vaccine, the nasal spray vaccine, which is a live tamed. It's an attenuated virus that's sprayed up into the nose. It's a miracle of modern science. That virus can stimulate the immune system, but it cannot get down into your chest, because if it does, it can't multiply there. It's cold adapted, as we call it. It cannot multiply at the slightly higher temperatures down in your lungs. So even that live attenuated virus cannot give you the flu. Can't hide behind that reason not to get vaccinated. That, as we say in Tennessee, that dog won't hunt.
Yeah, well, people, yeah.
Can I have one other thing? And that is the influenza vaccines protect you against 4 different types of influenza, but they don't protect you against all respiratory viruses. So it's not that uncommon during respiratory season that you would, in mid-October, get your flu vaccine and then a week later get a cold, right? So we just want to make sure that everybody recognizes that's not the flu vaccine. The flu vaccine is protecting you against the flu, and it works well to protect you against the flu.
Yeah, people have to understand the immune system is really cool. And so when you get a vaccine, your immune system is supposed to be stimulated. You might have a little bit of a fever. You might have a little bit of pain. You might get the sniffles. All of that is telling you the vaccination is working. Your immune system's recognizing the antigen, It's breaking it up into little pieces and showing the white blood cells different pieces of this piece of virus, so that way your immune system can manufacture all the things it needs, so that way when the game actually starts, it knows how to defeat it.
Bravo. Marla?
Okay, Bill, I think we have time for just one last question, so it's a two-parter. So the first part is, will receiving flu and COVID-19 vaccines at the same time cause worse side effects? And the follow-up is, when might we see a single combined vaccine for both COVID and flu?
I'll start with Rochelle, if you don't mind.
You know, I know they're working on a combined vaccine. I don't think we're going to see it. We won't see it this season, but I know they're absolutely working on it. And that would be a really welcome next step. Presuming we actually need another COVID vaccine. And I don't think that that's after we go through this round of boosters and what that shows. I'm not sure any of us know whether we would need another round of COVID vaccines. In terms of the side effects, you know, the side effects are similar for the COVID vaccine and the flu vaccine. They're probably a little more severe for the COVID vaccine in terms of aches and pains, in terms of arm pain and lymph nodes under your arms. I venture to say that if you got them both together, you wouldn't necessarily notice that you had worsening symptoms from one or the other, and that you probably would notice the COVID symptoms, vaccine symptoms, a little more than the flu, but flu vaccine symptoms, they're really essentially overlapping and pretty close to the same. I don't know if others have.
I would just add to that, it's prudent, as we tell everyone who gets COVID vaccine and flu vaccine, don't plan something very big for the next day. Yes, if you get one vaccine in one arm and one in the other, you may have two sore arms. Don't enter the weightlifting contest the next day.
Exactly.
Right?
Also, just got to throw this in there because pregnant people really wig out about those symptoms. Pregnant people are just as likely as anyone else to get, sort of the sore arm and maybe a little bit of fever, and that's okay. The fever doesn't last long. Take Tylenol, you're good to go.
Yeah, it's interesting. One of the things that I always like to explain to my patients is they tell me, I had these side effects when I got the vaccine. I had this fever, I had aches and pains. I'm like, that's not a side effect. That's the effect I want you to have. That's what I want you to have. And so I try to eliminate that term sometimes when people say side effects. That's not a side effect. You got a shot in your arm, you got a needle in your arm, you're gonna feel it. Of course it is. It's not a side effect. That's what you're going to feel. And so I think, explaining those types of things to people and allowing them to understand makes them say, oh, okay. And so then I think it becomes a little bit easier and people will accept it a little bit more. So that's what I try to do.
That's wonderful. I think we've come to the end of our time for questions. This has been a dynamic panel. I want to thank all of my friends who have contributed so vigorously, and I thank the journalists for asking their questions. None of us can predict whether it's going to be mild, moderate, or severe flu season, but we are certain that there will be flu activity. I'd like to leave you with a reminder about 3 steps to help fight flu. 1, you've heard it before, get vaccinated against flu each year. I can't overemphasize this message. And flu vaccines can be given at the same time as COVID-19 vaccines. Number 2, practice healthy habits. Do good hand hygiene. Cover your coughs and sneezes, not with your hands, but in the crook of your arm, please. And then stay at home if you are sick and wear a mask. Number 3, if you do have flu symptoms, please call your healthcare professional as soon as possible and take flu antivirals if prescribed. And then please join the NFID Leading by Example initiative and share your flu vaccination photos on social media, tagging NFID and including the hashtag #FightFlu. This news conference is sponsored by the NFID in collaboration with the CDC. Special thanks to all of our partners and the funders who make this activity possible, including AstraZeneca, Genentech, Merck, Sanofi Pasteur, and Securus. NFID policies prohibit funders from controlling program content. A video of today's news conference will be available on the NFID website at www.nfid.org. Thank you again, Dr. Walensky. Thank you, my colleagues, and to the many thanks of our NFID partners, as well as all of you journalists for what you do to help spread the word about these important issues. Thank you very much. Ladies and gentlemen, we stand adjourned. Stay safe and get vaccinated.